Good evening, how are you? Wish you are fine. I want to speak about Regenera Activa. In general, Regenera Activa is a way to have stem cells to give the client more chances to grow his hair. In general, there is a machine, we use it, and there are some tools should be prepared before the session. It's highly recommended to keep all the tools ready and sterilized as one pack. It is easier and a time saver. In general, it's a procedure more difficult than platelet-rich plasma than the PRP. In general, more sterilization and more sterile technique is used then we prepare the platelet-rich plasma. In general, we need 3 cc syringes, 3 syringes, and 5 cc syringes, 1 syringe, and 1 cc syringe, 9 syringes, and yellow 30 gauge, 6 needles, shaver, sterilized gauze, alcohol swabs, lidocaine injection plain without epinephrine, betadine, Regenera kit, which is I mentioned in another video, cone and punch and connector, and surgical gloves. It is in general 7.5 and 8, which is suitable for men, and sterilized forceps, saline, Focidine, and steri strip or waterproof film dressing, adrenaline or epinephrine vial for emergency. Steps. First, we should prepare all the previous tools, and the mastoid area, the area behind the ear, is shaved to 2 centimeter in maximum by the shaver. For the female, it is recommended to move inside by 1 centimeter. Clean the area by alcohol swabs. Inject 1 ml lidocaine plain all over the areas using 1 cc syringe. Clean the area by betadine swabs. Test the area using the needle. If no sensation, start to collect the biopsies. In general, as I told you before, there is difference between PRP, platelet-rich plasma, and the Regenera technique. Here we use biopsies. The doctor has to take the biopsies one by one from the patient using the punch, starting from the lower area to avoid excessive blood flow when taking the rest of the biopsies. The nurse has to take the biopsies one by one by the sterilized forceps and put it beside the edged blade on the holes of the cone. Then twist the cone until the biopsies disappear, then close the cone. Then we should add 1.2 ml saline in the hole of the cone using 3 cc syringe and put the cone inside the sequeled. Then put the square stick on it and put it in the machine. Then we should press the start button first, press last for 1 minute, and then it stops it automatically. You have to press it one more time, then means this step needs 2 minutes. Then we should draw the sample out of the cone using 2 syringes, 1 cc, then add 1.2 ml saline using other 3 cc syringe to wash any traces in the cone. Then put the cone again in the machine for only 1 minute. That means it is only one press. Then we should wear surgical gloves. From this point you should wear sterilized gloves and you should work in a sterilized area. The nurse should turn the machine on. Once it is on, you will see the red and green lights on. The nurse should open the kit and the sterilized forceps should be prepared. The nurse should pass the freed cover over the freed symbol on the machine and then press the button. The green light will be turned on. That means the machine is working for 1 hour. Then we should draw the samples out of the cone using 2 syringes, 1 cc. Now we have around nearly 2.4 sample. Then we should put the connector on a 5 cc syringe and combine all the samples in that syringe. Then complete the syringe by saline. We should separate the solutions in 5 syringes, 1 cc. Put the needle on each one to start the injection process. If there is bleeding, just press on the injury until the blood stops. If there is excessive bleeding and it is rare, just apply 1 ml adrenaline or epinephrine topical on the injury and it will stop. Sterilize the area by betadine, then apply Focidine, then close the area by Steri-Strip and a waterproof dressing. Tell the patient that he has to change it after 2 days and he must take a painkiller, Focidine cream, and it is preferable to take oral antibiotic for 1 week. Lidocaine plain is used to save the cell's viability for a longer time. In case you use 2 ml punch, you must take for biopsies. If you are using 2.5 ml punch, you must take 3 biopsies. If you are using 3 ml punch, you must take 2 biopsies, but you will need to close the wound by stitches. That's all about Regenera. Wish you will follow us. I wish that you will subscribe to my YouTube channel, and I wish that you will watch another videos about Regenera on my YouTube channel. If you like the video, kindly please go down, please subscribe to my YouTube channel, like, share with your friends. If you don't like the video, please make dislike.